Okay, I have made all of the content available in Module 4 for weeks 7 and 8. You have a new assignment in this module, so I want to review with you how I would like you to complete that and where you'll find everything. If we click on Module 4, you're going to have something that's going to look a little bit different. You will see a folder with all of your assignments. This includes some review, some protocol review, your quiz for this module, as well as your second examination. New to this module is what I call a protocol evaluation assignment. So I'm going to go ahead and open the assignments folder, and you're going to scroll down to where you see protocol evaluation. To open that document, simply click on it. And we're going to use this document to evaluate some images. And so after you've evaluated your images, which for this specific exam you'll be evaluating a CT chest with contrast for PE protocol. And so after you went through the lessons and you've learned about a PE protocol, some of the parameters for that, then you're going to apply that by looking at images. Then you'll be graded on proper use of complete sentences, spelling, grammar, your ability to compile the information into a well-summarized evaluation of the images, and apply the objectives that we've learned in class thus far, and make observations of the images based on what we've learned. So for the first question, you're going to evaluate your scan parameters. Scan parameters can be anything such as mask, KVP, field of view, window settings, so window width, window level, image slice thickness, pitch. Any of those things can be evaluated as far as scan parameters. Where the scan starts and stops. So the superior portion of the scan, the inferior portion of the scan, talking about those things. Any artifacts present maybe, which that can actually be addressed in 2. Question 2 says exam quality. So you're going to, for 2, evaluate the images as far as if your anatomy was included, if the correct anatomy was included, if the patient was positioned well, and again, all metal removed, is the patient positioned well, is the image quality acceptable. And then lastly, we will look at radiation dose. And so according to the radiation safety manuals, can you tell if the CTDI vol was included in the scan and how that compares to the ACR diagnostic reference levels? I've given you those. If it's applicable, your CTDI vol may not be available, but I would like you to answer these 3 questions after you've evaluated the images. And so now let's go and we'll evaluate, or I'll show you where to find the images. So CT-PE protocol exam images. This is where you will go to evaluate your images prior to answering the questions, or as you're answering the questions, you'll open your images. And so let's click on that and get that to open. Okay, so you can see we have scout images, a lateral, and an AP, and then that's followed by your exam images. Now there's a lot to scroll through, and so you will need to evaluate all of these images and then evaluate them. So you can look at things like graininess, motion, anything like that for evaluation, and you can see the contrast starting to enhance. And so by going all the way through the exam, which we're not going to for this purpose, evaluate your images based on those questions. After you have done that, make sure you submit your assignment. Under the protocol evaluation. So here's where you'll actually submit your document once you are finished answering the questions. Okay, make sure to let me know if you have any questions, and then I've also listed the due dates for the quizzes and the exam. Exam 2 is over the neuroanatomy section and the thoracic imaging procedures, and so chapters 15, 16, 19, and 20, and all of the content within those. Please let me know if you have any questions, and good luck.